ഇത്ര ഇമ്പ്രൂവ്മെൻറ്റ് ചെയ്യുമെന്ന് പറഞ്ഞത് പ്ലേറ്റ് എല്ലാം എടുത്തിട്ട് കറക്റ്റ് അല്ലേ? പറ്റുമെങ്കിൽ കുറച്ച് ഇമ്പ്രൂവ്മെൻറ്റ് ചെയ്യാം. പാടാ കുറച്ച് ഇമ്പ്രൂവ്മെൻറ്റ് ചെയ്യാൻ പറ്റും. ഈ പാട് ഇതും മാറ്റാൻ പറ്റും. ഐ തിങ്ക് എല്ലാം എക്സ്ട്രാ സമയമാവൂലേ? ഞാൻ നോക്കട്ടെ. Possible, I'll do scar also. Whatever possible, we'll do that. So chin. Guys, this pretty girl has a pretty challenging case. She's my old patient. She's been coming here for several years. I'm going to quickly say what was the issues that she had. So she had what is called as hemifacial microsomia with lateral or an oblique facial cleft, which we call it in the medical world or in the scientific world as Tessier 7. Tessier 7 or oblique facial clefts that usually start from the tragus and end at the corner of the mouth. This is the area of the clefting. Now, the most common clefting is a clefting that comes here that affects the lips. The next most common one that affects the both sides. Then you have rare oblique facial clefts that can go up to the eye. Now this is another type of cleft where it goes across between the mandible and the maxilla, like between the middle third of the face and the lower third, and cuts through on this side. And because of this clefting, there is an inherent issue of growth on that part of the jaw. So I'm going to explain that now. Now we're going to make her turn around this side. You're an engineer, right? And she's a bright girl otherwise. You can see she's an engineer. You've been seeing me now for what, 10 years? Etra varshai? That first in kandita? So about 8 years. So she's been coming to me for a long time because she had major issues. We have done what is called as distraction osteogenesis. She had a primary treatment, of course, done elsewhere, several treatments done before she came over to me. Now, you can see the current issue, and I'm going to explain what exactly has happened. Right, the first thing is, you can see there's a scar that goes zigzag here. There's a little bit of a depression. So this was the original cleft. So it had come till this much. You can see the scars. And now all of this is from the earlier procedures that were used to get length of this bone to get the soft tissue work done here. So for a cleft, and that's why you can see her mouth is still not exactly like that. You can see this probably needs to go up a little bit. You can see that the chin is still a little bit shorter than what it should be, and her lower third of the face is not matching with that of the rest of the face. Now, along with the soft tissue issues that you see, the really challenging part for these patients with hemifacial microsomia with an oblique facial cleft is the lack of bony support. So there's problem both in the hard tissue and in the soft tissue. So you have to deal with that by working on the bones, like what we have done, some distraction. We still have some issues of facial asymmetry. In this surgery, I'm planning to remove the implant that she has here. There's some loose tissue here. So I want to try and get the chin forwards as much as we can. I don't think we can do it more than a centimeter because of the earlier surgeries and because of the scarring and because of the tightness and the porosity of the soft tissue. The mother is also keen if I can do some revision and get this depression off. So I'm going to get this maybe more full, the cheek, so that this contour is kind of similar to that. And eventually she also wants me to do a little bit of the scar here and this one. I think this scar is something we would be able to give her excellent results. This scar is hypopigmented, and you can see it's also quite broad, so we should be able to correct this. This scar is quite a challenging one. There are 2-3 scars there I can see, and it's really thick. So we should be able to give some improvement for that scar. Now, so that's the plan. We're going to do multiple quaternary, pentenary, that is fourth, fifth time revision procedures. And well, I think all I can say is we'll be able to improve the way she looks now. Now we will not be still able to give her absolute symmetry or a perfectly balanced or a perfectly harmonized face. That's still going to be difficult because of the issues that she's got inside. With this scar revision, you can see this Avio 60 Proline. It's a 2-layer closure. We've got the 3 scars closed up there. And this has also resulted in some tightening of the skin contour of the cheek, plus the scar being removed. And I'm going to explain what this contour is as you see this picture, right? So this is how she was before we started, and you can see that scar that was really nasty, very, very thick, very, very hypertrophic, and also here also hypopigmented. So it's a very good reason we removed these both. I removed together. It's a pretty large one. Had to dissect more extensively. And look at this. This was a contour issue I was talking about. And there you see the depression that has been taken care of. You can see there's a nice cheek contouring here. This is not the right place for the dimple. If there be any dimple, it should be at the junction between here, somewhere here. But it's way too anterior, doesn't look nice. So by doing the muscle work here on the modulus and about, we were able to bring some effective change on the corner of the mouth, and at the same time bring about the change in the contour of the cheek. Not a problem. This is all only scar revision, and idu korchu muscles. So lip shape will be better, but this much thing is a foreign material, silicone. Upon you should make sure there is no infection. So most important thing you will do is we'll give you this tube. Take 4 or 5 or 10. I don't know how many you want to take. Don't use a hand. Just see, just little bit you got to release it, and then squeeze it inside. Okay. Like good quantities, then just rub it like that as a layer daily 2 times. So this will prevent infection. If saliva, food particle goes inside, it can get infected. Because it's 3 days onno aayitilla. Ivide namakku IV antibiotics kittarundu. Avade പോകുമ്പോൾ IV antibiotics കിട്ടത്തില്ല. So you have to take very carefully, because that is the main thing. Then don't sleep on the side. Cut it. You can see there is some improvement is there. You can see. You want to so you can see the improvement. Well, this was a very, very complicated, very, very challenging issue that she had, which was because of the secondary deformity, but it originally arose because of hemifacial microsomia. So if you see, there's some improvement. Kando, the facial balance has improved. Kando, hariyale. So this side hollowness have improved. The length we have adjusted little bit. Side view also maybe. So you can see the slight improvement in this view also. Then main thing, 1 week, in 1 week you have to be careful. See this side, improvement. This side got huge improvement. Oh, this is very nice. You get great improvement this side. Kando, just see. So you can see this side. तो यहाँ पे आपको दिख रहा है ये जो हाइट है ये काफ़ी कम था पहले, इसको हमने बहुत बढ़ाया है हाइट. दूसरी बात, ये जो स्कार्स हैं ये निकाल दी, आपको मालूम पड़ रहा है. ये जो नेक का स्कार ये भी नहीं है. जो यहाँ पे एक डिम्पल है उसको भी स्मूथ कर दिया है. Those are the 3 things. And the length has been increased. So maximum improvement is from the left side. From the right side, very minimal improvement. From front, medium improvement, because your main deformity is on the left side. So we have done maximum of what shall I say, correction on the left side. You understood? Give her the ointment also, and you come after 5 days. 5 days she can get augmented metronidazole and this gel. So വേദന എവിടെയാ അതുണ്ടാ ജോയില് ഈ സൈഡ് മാത്രം or you have pain there also? Only here, huh?